Some birthdays are going to age more than others. We all know that. According to a study now out of Stanford, aging comes with two big bursts. The first is at about age 44, and the second is at age 60. Much of that has to do with changes in our metabolism. Joining us now to talk about that and some other health topics of the day, Dr. Jeff Pothof, UW Health's Chief Quality Officer. Thank you so much for being with us today. You know, I looked at this study and I thought, okay, 44 and then we're okay. No, this new study is showing that these two big swings come early 40s and then again at 60s. Why that gap there, do you think?
Yeah, I don't think we fully understand why that gap is there, but we used to think that aging, especially our metabolism, was just this binary thing where it just slowly started to slow down as you got older. And it turns out that's not the case. There's actually short periods of time where things change somewhat abruptly. Like you mentioned, the first one at age 44, this is where our lipid metabolism, or kind of our fatty acid metabolism, gets worse. So what might people see? They might see that they're having a hard time keeping that cholesterol level in a good range once they hit about age 44. When you reach age 60, the thing that starts to get more difficult is carbohydrates. So you might notice that it's a little bit harder to keep that glucose level in check, or less carbohydrate or more you eat, maybe the more you're maintaining because you're just not metabolizing that quite as quickly. So kind of interesting that things are not so linear. They're kind of like little spurts here and there as our metabolism changes as we get older.
Well, you know, and they're saying, and this, as I'm reading this now, it's saying alcohol and caffeine, there may be more sensitivity to that, especially the cases of caffeine. So what's the action item here? Should we limit how much coffee we're drinking, how much caffeine as we hit this 44 mark and the 60-year-old mark?
It could be. Instead of the 3 cups of coffee that you needed when you were in your 30s, you're down to 2 in your 40s and maybe just 1 cup of coffee when you're in your 60s to get the same response as far as the caffeine goes.
Yeah, and especially keeping your eye on cholesterol, especially in the 40s. They're saying that that's another thing to ask your doctor about. The other topic we want to get to is prenatal care for pregnant women. It sounds like fewer and fewer women are getting prenatal care, even though fewer women are having a pregnancy.
Yeah, and this is a bit of a concerning trend. So obviously women who have appropriate prenatal care, their likelihood of doing well with the pregnancy and their baby doing well increases quite a bit. I think there's a few reasons why we're maybe seeing less women getting prenatal care. I think one, it's harder and harder for like rural hospitals and rural clinics to stay open. Healthcare is consolidating. That means women might have to travel farther to get their prenatal care, and for someone that might just be too much of a burden. I think likewise, what we see is there's different malpractice risks in different parts of the country. That's a disincentive sometimes for obstetricians to practice in certain areas, requiring women to then travel further to find their nearest obstetrician. And then I think the last thing is we're seeing a lot of kind of flux with reproductive medical care, and that might be disincentivizing some obstetricians from practicing in certain parts of the country, worried that they could face criminal liability or other things related to the care that they're trying to provide pregnant women. So hopefully something that we need to put a little effort into, because we certainly don't want to have women without prenatal care in the United States. That's just not good for anybody.
Exactly. It's so important, such an important topic. So that's all we have time for today. We have a couple more to get to, but we're going to see you again before the end of the week. So thank you for your insight on that. And again, boy, it's hard getting old, isn't it? 44 and 60? Come on.
Better than the alternative, though.
That's true. Thank you, Doctor.